We'll get an audio check, just your name and your role, please.
Yes, Dr. Timothy Gilbey, the Infectious Diseases Specialist for Murrumbidgee Local Health District.
Everyone's happy? Alrighty, so we might just start off, where is the situation at the moment for the region?
Yeah, so of course you'll be aware that there's been increased numbers of cases in Victoria recently, particularly around several of the postcodes in Melbourne. Those have been published as hotspots of increased COVID-19 cases in recent weeks, and stemming from that we've had some new cases arise near the border area in the Lavington-Albury region, where we've had two confirmed cases which have been traced and confirmed to have direct contact with known hotspots. So the source is clear, which is always reassuring. So at the moment we are following those cases in terms of the contact tracing, and there's been isolation that's been instigated to keep those under tabs.
Do you know if they did much travel around the region before they were, I guess, diagnosed and isolating?
Yeah, good question. So in actual fact, there wasn't a great deal of exposure. There was some travel through the area over a 24 to 48 hour period only, and not a lot of particular contact. So again, it just speaks to the need, to be vigilant. We are in the midst of a pandemic, despite the fact that in New South Wales we seem to have had quite good control with falling numbers of cases. It's a reminder to all of us to continue to adhere to those social distancing messages and hand hygiene practices. Casual contacts, even with people who are asymptomatic or minimally symptomatic, runny nose, what have you, can result in a transmission of COVID-19, and we all need to remain vigilant with that in mind.
Are the two cases linked to one another?
They are, that's right, yeah. So one case was probably the vector, if you will, exposure to the known hotspots, and the other one is a household family member of that case.
And how many people have you got isolating who've come into contact with those people?
Yeah, so there are approximately 4 people who are isolating as a result of that exposure in those cases. Luckily, given working from home, etc., and pre-existing isolation, there hasn't been a great deal of exposure to the Lavington-Albury community at this stage, which is great.
Excellent. And I guess we're up in Wagga at the moment. Is there any, risk factors or anything for people up here? Are you expecting it to maybe come a little bit further north?
Look, so of course we're all, that's what we worry about, and you'll be aware, of course, that there's going to be a closure of the border, New South Wales-Victoria border, upcoming on next Tuesday, I think it is. With that in mind, but regardless, we do have transmission in New South Wales. It's important to not be too fixated on one particular area, although at the moment, certainly areas of Melbourne and Victoria seem to be the main hotspots where we have rising cases. The same thing could happen anywhere, where people become lax, where the vigilance wanes, and particularly as we've got a lifting of the isolation and restriction measures in place, we must be remain cautious that we can have a case rise at that stage. So the message that I would say in answer to your question would be to remain vigilant in all circumstances and try to maintain social distancing where possible.
Tim, do we have any information about where the clinics will be, the testing clinics?
Yes, not specifically from my end, sorry, I don't have that information. They have been setting up mobile testing in the Lavington area. Maybe we'll come to that later. Yeah, thanks, sorry about that.
That's right. Is there any more information you can give out about these cases, sort of ages, genders, anything like that at this stage?
No. Other than we have one case who had clear exposure to one of the areas in Melbourne that we know has elevated numbers of cases. The actual degree of contact within that area was relatively minimal and transient, actually, just a train ride, taxi ride, even whilst trying to wear mask and maintain precautions that way. Just it speaks of the need to remain vigilant with even those kind of short exposures in public settings. There can be a transmission event.
And there was a little bit of talk around when Melbourne went into some lockdowns that people were trying to escape those lockdowns and come north for the school holidays. Have you heard anything about that? Is that a bit of a worry for your team?
It is a worry. I mean, we saw similar behaviours actually in Italy earlier on in their outbreak, and that led to kind of disastrous consequences. So I would caution people against trying to cheat what seems to be the rules or cheat the system. This pattern of fluctuating cases will continue for the duration of the pandemic, and from my point of view it will continue until we have a widely available vaccine. We will be expecting that over periods of time there'll be areas that will pop up that will have a spike in cases following particular episodes of mingling, any social interaction episodes, and at that time there will be a need to instigate local infection control measures, and those are important so that we prevent widespread transmission of COVID-19, and so that we don't end up in situations like we're seeing over in the US and in other countries with really high case burden. So please adhere to the public health advice. If there's quarantine measures put in place, it's to protect you, it's to protect your families and the wider community. So take that as it's intended.
Thank you.
Yeah.
All good? Yep.
Great.
Thank
Thank you.
you.
Cheers.
Next.
Okay, hello everyone, thank you very much. I realise there's a great deal of interest in a large police operation which is now massing obviously on the border, and they'll be subject to some announcements by the Commissioner in a very short order today. But I just wanted to say to people, some very good advice there from Dr. Tim around some precautions to take in respect of generally fortifying the community against infection. But in terms of the closure of the border, suffice to say is clearly it's a very large operation. It involves a significant number of staff from the police, but also assistance from other partner agencies, and particularly local government, Transport for New South Wales, but vital to the success of the operation is the collaboration and the cooperation from the community. So to that end, we want to assure the community safety is our focus. Part of that obviously is road safety. We're talking about closing roads that do have at times very, very high traffic volumes. So a significant part of our planning and our operational effort is around ensuring motorists are safe and that there's not undue risk to motorists and our staff and supporting agencies working with police on those closures. So it will be a large job. It will be commanded by an Assistant Commissioner and a very, very well-resourced and extremely experienced incident management team. Obviously, police from the Riverina District will be part of that. There are 4 border crossings that are part of the Riverina District that we're making plans around now. But as I say, suffice to say, our focus is on community safety, and that's not just the closure of the border. It's about road safety and the safety of our own employees as well. So I'm happy to take questions in respect of that or the broader emergency management arrangements that are supporting around health in terms of this health pandemic. But please bear in mind there are other announcements in Sydney shortly that where more detail will be revealed, particularly around the health orders and the larger operational planning for the police.
Are police keeping an eye out, I guess, for those Victorian travellers who are trying to escape lockdown per se? Are you monitoring people in the community?
It's been for some time. Obviously there have been orders in Victoria around certain suburbs that have been locked down, and we've already been doing work with public transport, with air transport, rail and road, police from police districts and the Traffic and Highway Patrol monitoring the roads and checking bona fides as and when that's necessary. Obviously the closure of the border, which is only happens by virtue of an order issued by the Health Minister. It doesn't change the basic precepts of that those operational settings, but obviously all it does is escalate it. So we'll continue to do those things we've already been doing for some time, all in the interest of community safety.
There was the order last week that to pull over people with Victorian number plates. Do police have the technology to scan number plates and be able to tell where they're from and pull people over if they are from Melbourne hotspots?
Well, we have technology to do all sorts of things. I won't necessarily divulge those in this forum, but suffice to say that, everyone knows that number plate recognition technology is very advanced, and we'll use all those tools that are at our disposal to ensure people are safe.
So was that used over the weekend at all after that announcement was made?
Look, I wouldn't want to comment on that specifically, but we have significant capacity in terms of our technological apparatus.
Have you pulled many Victorians over in our region? Since sort of those announcements last week.
We have, yes, we have, and we'll be continuing to check the bona fides of travellers. And we do that as a matter of course anyway, in terms of just reducing fatigue and road trauma. So again, that's nothing new. We're trying to, obviously at all times, we're trying to push ourselves into the public safety space in such a way as to not be invasive on people's lives. These arrangements can be, at the very least, very intrusive, but that's not what we're trying to achieve. We're trying to achieve health and safety for the public.
Well, Bob, just resources-wise, this could go on for weeks, if not months. We well staffed enough, I suppose, to have New South Wales officers policing the border, as I understand you've been asked to do.
Yeah, well, look, obviously New South Wales is a sworn policing contingent of around 17,000 officers. They are spread around a big state, and they're all very busy. But we're very good at taking our capacity and pushing it where it needs to be. Our ability to do that was evidenced early this year when we had the bushfire events across the state, and particularly we had many dozens of police bumped into the Snowy Valleys cluster in the east of our district at that time to support policing and public safety operations there. So the state of New South Wales has proven we can do it, and this is an extension of that. Obviously, yeah, it will take a lot of resources, but we can do that. Okay. Thank you very much.
Well, good afternoon, everyone. Tonight at midnight we will see the closure of the New South Wales and Victorian border for the first time in 100 years. The last time it was due to the Spanish flu, this time the coronavirus pandemic. And I think it's a timely reminder. We've heard from health today, we've also heard from police. It's a timely reminder that we are far from seeing the end of this pandemic, and it is incumbent upon all of us in all of our communities to do everything that we can to keep ourselves, our families, and our communities safe. And what we can do personally there hasn't changed at all. We need to keep good hygiene, we need to wash our hands, we need to make sure that if we're unwell we stay home, we need to reach out and get testing if we have even the smallest or simplest of symptoms. I'm very impressed with MLHD and how they have ramped up in recent months. We have more mobile testing vans out and about in our communities than we have ever had before. And so it's very accessible for all of our communities, even the smallest of communities, to reach out and to get testing. I do appreciate, and we as a government appreciate, for those communities across both sides of the borders, this is a very challenging time. The Albury-Wodonga community in particular is one that really does operate as just one community, and they have so many shared facilities. Their workforce comes and goes frequently, something like 50,000 vehicle movements a day between those two communities. So this is a very challenging time for them, but together I know that we can work through this. It's incumbent upon all of us that we remain patient and that we all do our bit to keep our communities safe.
We're sort of 11 hours away from this border closure happening, and before I left the office, the Service New South Wales permit system wasn't up and running yet. Have you been fielding many calls, people concerned that they don't know what to do permit-wise yet?
Oh, absolutely. I mean, the permit system is still getting up and running to its full capacity. We are aware that there are people reaching out for permits at this point in time, and I can only encourage those people to remain patient. We are working as quickly as we can to get everyone's permits processed so that their lives can continue as close to normal as possible.
Do you think is there a lot of concern in the community about how individual situations will work, and have you been able to answer many people's questions, or do you still have a lot of questions?
Look, this is an evolving situation, and everyone's circumstances are different. And that's why, Services New South Wales, we set up in March a hotline, 137788, and we encourage people definitely to reach out to Services New South Wales, or indeed to my office if if people do have queries. And as I said, we'll continue to work through these one at a time as quickly as we can to make sure that, that our children can still go to their schools, that people can still get to and from work, that our freight can still move freely around the region, because we want this to have as minimal economic and social impact on people as possible.
As far as freight movement is concerned, I know there's a lot of truck drivers based in Wagga or Albury that actually do go down to Melbourne quite frequently. Is there any plan for them to limit their travel, or are they still just going to be doing that back and forth?
I think that will come down to the permits that they are able to obtain in relation to how they move around and get their work done. There's no doubt that every business and every individual will need to adapt to these new conditions that we find ourselves under. But at the end of the day, I think we can all work through it patiently and keep in mind that it is all about keeping our communities protected and keeping our communities safe. It mustn't be forgotten, and as member for Cootamundra, it's always top of my mind that all of our communities are small and they all fit into the highly vulnerable categories. We have a lot of our communities over 70 years of age or over 60 years of age with underlying health conditions. In communities like Narrandera, there is a higher Aboriginal population than perhaps other parts of the state. So whilst I do appreciate that people will be frustrated because of the impact that it is having on their lives, at the end of the day, this is about keeping everyone safe.
A lot of people have been calling for this closure for a while and saying, why didn't it happen sooner? Do you think it should have happened sooner?
I think that the Premier has acted very, very decisively yesterday when she's received that information from the Chief Health Medical Officer, having kept an eye on the developments in and around Melbourne itself. These are very difficult decisions to make, and we are very well aware of the impact that it will have right along the border in so many communities. So I think the decision has been made at the right time for the right reasons.
Good, thank you. We might just get your name and your role with us, Bill, if we could.
Sure. Carla Bailey, Acting Chief Executive, Murrumbidgee Local Health District.
Beautiful.
All good. Sorry, just 1 second. Right.
Beautiful. Alrighty, Carla. So where are we up to, I guess, with the health response now that we've got a few more cases in the region, and where are things moving?
Yes, thank you. Good question. As you are all aware, there is an increased transmission rate occurring in Victoria, specifically in Melbourne. Murrumbidgee Local Health District has responded to that and continues to work with Albury Health in supporting residents in the Albury community. We have established clinics running, which we've had running for some time now, including our mobile testing van, which Steph referred to earlier, that goes around to some of our more rural communities, particularly along the border area. We've also established today an additional clinic in Lamington to support Albury residents, and we'd like to thank Albury residents for coming forward for testing. This clinic is there to encourage people to have testing, those that have symptoms, and we will continue extending the hours of that clinic based on the demand in the community.
Why did you choose Lavington of all places in Albury?
We chose Lavington in addition to, there are 2 other clinics that run in the Albury-Wodonga area. So there's the Wodonga Respiratory Clinic and also the Albury-Wodonga Clinic. So we chose to just set up in another area there at the Murrumbidgee Community Centre. We've been working with the local council in Albury, and that was the suggested place for us to set up. So that's why we've established the clinic in that location.
From your perspective, what challenges do you expect to face with the border closure?
Obviously there are some challenges around staffing. There are some of our staff who reside over the border who work for us, and we're working through a process. You spoke earlier about the permit system, which is currently being established. In the interim, we have an arrangement with a letter of exemption and a staff ID badge, which will allow our staff to transit across the border to attend work, given that they are essential workers, being healthcare providers.
Will any of the staff from Wagga and up here have to travel down to assist with any health things down the border, or are they going to stay maintained up here?
We have a number of staff that are located along the border, which we will utilise throughout this process. However, our staff are able to, agile enough to move around as required. So we will just manage it on a day-by-day basis depending on the demand in the area. How
And we
long
do
will
that
that
across the
test-
district as normally anyway.
How long will that testing clinic at Murrumbina be in operation, and do people need to book in for it?
Yep, so the testing clinic started this morning at 9:30 and will run till 8 p.m. tonight, and it will also run from 8 a.m. till 8 p.m. tomorrow night. You don't need to book in. There is a booking system, so we have a mix. We have people that can book an appointment and arrive, and we also have the ability for people to drop in.
There was some reports of people going to those clinics and being turned away because they didn't have an appointment. Is that the fault of the people running the clinic down there?
I think that was just a bit of misunderstanding and miscommunication. That's not the case, and we've confirmed that with the Minister's office as well. People are absolutely able to turn up without an appointment. And we have a process for people that have an appointment, and also a process for those people who drop in.
So if people turn up, they won't be turned away, just to confirm that they can go, they don't have to call them.
No, that's correct. They don't have to call the hotline, and they won't be turned away.
In terms of tomorrow, obviously once it all comes in tonight, is it just sort of see how tomorrow goes in terms of staff getting through border restrictions and whatnot, and then do a bit of a reassess tomorrow as to how it's all going?
Yes, we'll work closely with our partners including the police, ensuring that our staff are able to access their facilities in the appropriate timeframe. So we'll continue to do that.
Are you able just to quickly let us know where those testing clinics are again, just if you have them there?
Yeah, so there's one located in Wodonga on Beechworth Road. There's one also in the Albury-Wodonga Health area, which is in the Wodonga campus, and then we've also got the pop-up clinic, which is today and tomorrow at this stage, with further planning underway to extend that clinic, and that's at the Murrumbina Community Centre in Lavington.
Is that in addition to all the clinics that are travelling around
Yes.
the river in here?
Yes, so that's an additional clinic we've started this morning.
Is MLHD aware of the active case that's been listed for the Wodonga LGA, and is the MLHD liaising with Albury Wodonga Health and the DHHS in Victoria?
Yes, so we obviously the two cases that Tim referred to are in our area. The other case I can't confirm, and that's been discussed through the Chief Public Health Officer and Medical Officer of the state with Albury, Wodonga and Victoria.
There obviously have been, concerns, and people are worried about how this is going to affect them. But from a health district perspective, how important do you think a border closure is?
Look, I think it's important that we do everything we can to keep our community safe. Obviously, we're in the healthcare industry, and safety is absolutely paramount to everything that we do. So we are supportive of the measures that are happening, and we will manage the situation with both our staff and our patients moving forward.
Just back on those people that were turned away, have you contacted them since and had them back in for testing? Do you know that yet?
I don't have that level of detail, but we have been in contact with the teams that are out at the clinics, and we've been talking to them regularly.
I'm happy.
Thanks very much.
Thank you.
Thank you.
Thanks.
Everyone?
I think so.
Good.